So let me move on and talk a little bit about what I think the future holds for CTC. I had mentioned before that I think that decreasing the cathartic is going to be very important. I think even the gastroenterologists have stated that if you could get rid of that laxative, boy, you would bring so many more patients in for screening. And so this was a study that Alex Keaty actually worked on with me that we published, looking at reduced bowel preparation using a 2-liter PEG and comparing it to magnesium citrate. And we found that actually 2-liter PEG patients liked equally well compared to magnesium citrate, which was that little bottle, the 10-ounce bottle, and it was equally effective for bowel cleansing. And actually, patients had better tagging quality, and the interpretation times were shorter with the 2-liter PEG solution. Now, what's the problem with this is that the 2-liter PEG solution that we used for this was specifically by a particular manufacturer where you would think that with the smaller volume of PEG that it would be less expensive. It doesn't work like that, but because with this smaller volume it was actually more expensive. So I think that that sort of is an issue in terms of dissemination. Non-cathartic CTC trials are starting to come out, and in fact 3 of them were published just last year. The Zalis paper in the Annals of Internal Medicine was multi-site. It included MGH, and also we participated at the San Francisco VA. You can see that this was performed in average to moderate risk patients, over 600, and it showed excellent sensitivity for large polyps at 91%. So the results were really good. Then came the Stoop paper out of the Netherlands, and this was published in Lancet Oncology. Large number of patients, and the analysis was a bit different. They looked at yield per participant versus yield per invitee. And they found that for yield per participant, colonoscopy actually outperformed CTC. However, when you looked at the yield per invitee, then CTC outperformed optical colonoscopy. And you can see a 55% improvement in screening participation. Then came this 3rd paper on non-cathartic CTC by Zuoko, published in European Radiology, large number of average risk patients, and had excellent results, excellent positive predictive value, 93–94%, and a very low false positive rate of 5 to 6%. So I think, very promising, but we're not there yet. And when you dig into the details of each paper, which I don't have time to go into with you, there are specific issues in each of the papers, I think, each of the trials, where we still have to work on in order to get to disseminate a non-cathartic version of CTC.